So let's talk a little bit about Chalazia and blepharitis. These are really, really frustrating problems, not only for patients, but for doctors like myself. And that's because there really is no perfect solution. There is no cure. There are things that we can do to improve the situation, to minimize symptoms, and limit the impact on quality of life. But it requires ongoing effort and perseverance. So let's talk first about Chalazia. A Chalazia is also known as a sty, and it is basically an inflammatory reaction within an oil gland. When the oil gland gets blocked up, the bacteria accumulate and the body forms this tender, red, painful lump. Now, even though I mentioned bacteria, and they are involved in part of the inflammatory reaction that the body has in these conditions, it's really uncommon for Chalazia to actually become infected. And so most patients with a sty, even if it's really large and very swollen and really red, don't actually need antibiotics, especially not oral antibiotics. Chalazia happen most commonly in patients who have blepharitis. And so what is blepharitis? Well, it's an inflammatory state of the eyelids. You have a lot of different oil glands in your eyelids, and they normally produce a nice smooth oil, kind of like cooking oil. But in blepharitis, they become blocked up and inflamed, and the oil product that they produce is thicker, more like toothpaste rather than cooking oil. And as that toothpaste-like substance builds up in those glands and the bacteria accumulate, your body can develop more of an inflammatory response. And this can lead to redness of the eyelids, sometimes redness of the eye, because of course blepharitis is associated with dry eye. Why is that? Well, the oil glands normally produce this nice smooth cooking oil, right? And that forms an important part of your tear film that helps to limit or slow down the evaporation of tears. So when that oil component isn't present, your tears evaporate quicker, they don't spread as evenly on the surface of the eye can dry out, and that can lead to redness and irritation. People with blepharitis often note a foreign body sensation, right? It feels like there's something in your eye. Sometimes this is worse in the morning because that thick toothpaste-like material can build up overnight. Sometimes it's worse at the end of the day because at the end of the day, the dry eye symptoms often tend to become worse and give you more symptoms. So what can you do if you have a chalazion? Well, I think the important thing to remember is that most Chalazia will resolve on their own. I would say about 90% go away within the first month. But there are things that you can do to improve the symptoms, so to make them less uncomfortable and hopefully to speed up the resolution. I think warm compresses are probably the most helpful thing that you can do. Really, the theory behind a warm compress is you apply the heat to the eyelid. This softens and melts some of that thicker toothpaste-like oil. And then after the heat has been on there for 2 to 5 minutes, you can apply a little bit of pressure simply with your index finger pressing on the eyelid back towards the eyeball. You don't want to get carried away with this and cause a lot of irritation, and you certainly don't want to try and pop a chalazion or a sty, but a little bit of pressure is helpful to encourage that gland to drain. If you have blepharitis and a lot of the symptoms that I talked about, building in warm compresses to your daily routine is often very helpful because the better you get those oil glands functioning, the healthier your tear film will be. You'll have nicer oil that helps the tears spread more evenly and helps limit their evaporation, and the more comfortable your eyes will be. The other thing that you can do at home if you have a chalazion is to try and focus on minimizing the bacterial load on your eyelids. Right, I've mentioned bacteria several times, and again to emphasize that chalazion is generally not an infection, but the bacteria are part of what drives the body's immune system to develop this inflammatory reaction, and so decreasing the amount of bacteria can be really helpful. There's a couple of different ways that you can do this. One is by using lid wipes. So these are commercially available. You can buy them at the drugstore if you like. They're a little towelette that you basically use to scrub the base of the eyelashes, and I'd recommend doing this once a day. Alternatively, if you'd like to make your own home concoction, you can use a little bit of baby shampoo, dilute it 50-50 with water, and then take a Q-tip and use that to scrub the base of the eyelashes. If wipes and scrubbing aren't really your thing, well then hypochlorous acid spray is another great option. Again, you can buy this at the drugstore and you just spray it on the eyelashes at bedtime. If you're one of the unfortunate few whose chalazion does not go away within the first month or so, I think it's reasonable to seek medical attention. Now, when people come to see me for chalazia, my job is twofold. First is to make sure that it actually is a chalazia, because there's all sorts of things, including little skin cancers, that can present as eyelid lumps and bumps. Second thing is to talk about what we can do to help improve or encourage this chalazion to resolve. And so in my hands, oftentimes the first thing that I will try for a chalazion is an injection of steroid. Again, that goes back to my whole spiel about believing that this is primarily an inflammatory reaction. If you have a very, very large chalazion that's very fluctuant, feels like there's a lot of stuff in it, then sometimes a small procedure where we actually drain the chalazion is helpful. Oftentimes we combine this with a steroid injection as well. So to summarize everything up, chalazions or styes, they're common, unfortunately, and they're difficult because they don't go away super fast all of the time, but they do usually go away. And there's no magic solution or perfect cure for them. But there are things that you can do to improve them, including warm compresses, lid scrubs, or hypochlorous acid spray, and things that a doctor can do to help them along, including an injection of steroids or an incision and drainage.